Welcome to our family planning clinic. Know the facts about family planning during pregnancy. Talk with your partner and health provider about family planning during pregnancy. Go for a modern family planning method soon after delivery.
I am Nurse Bidemi Shobowale. Today I'll be talking about the different types of family planning methods for women who have just had a baby. You can use them to plan your future, space your pregnancies, achieve your dreams and ambitions, and live a fulfilled life, including being the best mother and partner you can be. It is important to start discussing your family planning choices with your partner once you get pregnant. Family planning methods are safe and can be used immediately after delivery. You will return to your own fertility after you stop using a family planning method. Ask your family planning provider for more details to choose a method that suits you. Let's start with the lactational amenorrhea method, LAM, also known as exclusive breastfeeding. Exclusive breastfeeding can prevent pregnancy, but requires 3 conditions. Number 1, your menstruation has not returned after giving birth. Number 2, you put the baby to breast day and night on demand. No food or water. Number 3, your baby is less than 6 months old. If all the 3 conditions are not met, go for another modern family planning method to avoid stories that touch. Let us go through the different short-acting methods. Male condom. The male condom is made of thin latex rubber and coated with lubricant or spermicide. It is worn over an erect penis. It is important to know that a new condom must be used with each round of sex. The male condom protects against pregnancy and sexually transmitted infections, STIs, including HIV. Female condom. The female condom is made of a transparent plastic film with flexible rings at both ends. To use it, you place it into the vagina, and you can do this up to 8 hours before an anticipated sexual activity. It fits loosely inside the vagina. And like the male condom, you should remove it after each sexual act. The female condom also protects against pregnancy and sexually transmitted infections, STIs, including HIV, if used correctly. Now, I will talk about the oral pills. There are 3 types of oral pills: mini pills, combined oral pills, and the emergency contraceptive pills. The mini and combined oral contraceptive pills require that you take 1 pill every day at the same time to prevent pregnancy. You can start the mini pills immediately after delivery. These are safe for breastfeeding mothers. The combined oral pills can be used from 6 months after delivery if you are breastfeeding. You may experience irregular bleeding during the first few months of use, after which you may experience a lighter and more regular bleeding. You might also experience delayed or absent menstrual flow. If this happens, it is normal. If you have any question, you can ask your provider. The emergency contraceptive pills are for emergency purposes only and not suitable for regular use. They are safe for breastfeeding women and can prevent pregnancy only when taken within 5 days after unprotected sex. They are, however, effective when taken as soon as possible and will not work if you are already pregnant. As I said, it is not for regular use. If you need to use it often, you may consider a long-acting modern family planning method. Injectables are hormonal contraceptives that are given in the arm, hip, or buttocks. There are 3 types of injectables, namely Noresterat, Depo-Provera, and DMPASC. Noresterat is taken every 2 months, while Depo-Provera and DMPASC are taken every 3 months. They are safe for breastfeeding mothers and can be started 6 weeks after delivery. Before then, you can use another method before your baby is 6 weeks old, just to avoid stories that touch. Now that we have gone through the available short-acting methods, let's go through the long-acting methods. There are two types: the intrauterine devices, also known as IUD, and implants. The intrauterine device, also known as IUD, is a small, flexible plastic device placed in the womb or uterus. It prevents pregnancy for 5 to 10 years, depending on the type. IUDs are safe for women, including breastfeeding mothers, and can be inserted within 48 hours after delivery or 4 weeks after delivery. Some women may experience changes in their menstrual patterns which can be prolonged or heavy. These are normal and temporary. If you have any questions, see your family planning provider. The implants are either 1 or 2 small rods, about the size of a matchstick, inserted under the skin of the upper arm. They prevent pregnancies for up to 3 to 5 years, depending on the type. This method must be inserted and removed by a trained provider. It is safe for breastfeeding mothers and can be inserted immediately after delivery. Some women may experience changes in their menstrual patterns, which can be irregular, prolonged, frequent, or no menstruation at all. This is normal and temporary. You can ask your family planning provider if you have any question. Finally, there are permanent family planning methods that can't be reversed once they are done. These are vasectomy for men and tubal ligation for women. Vasectomy is also known as male sterilization. It is a permanent method for men who no longer want children. It is a simple surgical procedure and does not affect the man's sexual performance. You can ask your family planning provider for more details. Tubal ligation is a permanent method for women who do not want to get pregnant again. It is a simple surgical procedure where a health provider ties the fallopian tubes that carry eggs to the uterus. Many women are using a family planning method to space their pregnancies and plan for their future. Remember, there is a method that suits you. It is better to start the conversation about family planning with your partner while you are pregnant, so that you have a plan once the baby comes. For more information about these methods, talk to your family planning service provider and pick a modern family planning method today. Thank you.
Know the facts about family planning during pregnancy. Talk with your partner and health provider about family planning during pregnancy. Go to a health facility to pick up a modern family planning method soon after delivery. Get it together for a brighter future